some technical glitch. So today we are discussing about the diuretics. So diuretics can be asked in your MBBS as a full question. It can be asked as a viva question as well as it can be asked as a short question. So what is the physiological basis of diuretic? So this can be a question. So starting from the basic, number one is your carbonic anhydrase inhibitor. So they are working on PCT. If you remember, on PCT, bicarbonate is absorbed. How? Because of the carbonic anhydrase. So now tell me, if you inhibit carbonic anhydrase, okay, what will happen? Bicarbonate will not be absorbed. And acetazolamide drug, the carbonic anhydrase drug, it is one of the best drug for mountain sickness because it will hasten your acclimatization. In the respiratory physiology, you must have read about acetazolamide. So the first diuretic which you should write is your carbonic anhydrase inhibitor, acetazolamide. So acetazolamide is the first diuretic. It is not a major diuretic. It is a mild diuretic, but more often it is used in acclimatization. And the second diuretic, which is the best diuretic, it is asked often in your viva, and that is loop diuretic. So can anyone tell me about the loop diuretic like furosemide? So loop diuretics are working on NKCC channel. If you know sodium potassium 2 colloid channel, this is the same channel which is important for counter current mechanism. It is the same channel which is maintaining medullary hyperosmolarity. So medullary hyperosmolarity is maintained. Why? Because of NKCC, because of the counter current multiplier. And if you block that NKCC, if you block sodium potassium chloride channel, water will not be absorbed. See, normally more than 99% of water is absorbed. Why? Because medulla is hyperosmolar. Because of the counter current multiplier. We know that. And if you block the same channel, NKCC, sodium potassium 2 chloride channel, it will cause severe diuresis. That is why in pulmonary edema, in congestive heart failure, sometimes in hypertension also, we are using loop diuretic. So, which is the best drug of choice for edema? Answer will be loop diuretic. Because loop diuretic is working on the main point, your countercurrent mechanism, the same channel, NKCC channel, sodium potassium 2 chloride channel. So, first is your carbonic anhydrase inhibitor. Please remember these words at least. This is a short session. I will give you the crisp content which is important for your all type of question. It can be long question, short question. The first is your carbonic anhydrase inhibitor, like acetazolamide. More commonly, it is used for glaucoma because it is not a wonderful diuretic. But the second diuretic, the loop diuretic, is one of the best diuretic. Why so? Because it is working on the main channel, NKCC. Now the third one, if you remember the DCT, distal convoluted tubule, DCT. If you remember the DCT cell, there is a channel called as sodium chloride co-transporter. Sodium chloride co-transporter or NCC. That was NKCC, this is NCC. On loop of Henle, we have NKCC, and here we are talking about NCC, sodium chloride channel. So the question arises, which drug is going to block NCC? Any answer? Answer is thiazide. So thiazides are also wonderful class of diuretic. So first was carbonic anhydrase inhibitor. Second is loop diuretic. Third will be your thiazide. Thiazides and loop diuretics both are commonly used as diuretic. What is the main difference in their functioning? Loop diuretics work on NKCC. Thiazides work on NCC, sodium chloride channel. And regarding the side effect, loop diuretic loses calcium from the urine. It loses calcium from the urine. Okay, so loop, remember the loop. In the loop, there are two O. In the loop of loop diuretic, calcium is coming out. So clearance of calcium will increase in loop diuretic. Okay, good evening, doctor. So calcium will increase in the urine in case of loop diuretic. But in case of thiazide, calcium absorption is increased. That is why thiazides are one of the best diuretic and also given in case of recurrent kidney stone. Okay. The next diuretic is your spironolactone. Okay, this is the diuretic which is potassium sparing. It is working on aldosterone. It is aldosterone antagonist. Okay, you know aldosterone? It absorbs sodium and secrete potassium. So if you block aldosterone, if you are giving aldosterone antagonist, okay, sodium will not be absorbed and potassium is not secreted. So potassium will be spared. That is why they will ask in your viva, which is the only diuretic, I mean not out of all, which is the potassium sparing diuretic. Then your answer will be spironolactone because loop diuretic causes hypokalemia. Okay, thiazide causes hypokalemia. So you must know certain diuretic which can spare potassium to prevent hypokalemia, and it is a often asked MCQ short question, physiological basis as well as your viva question that which is potassium sparing diuretic, and your answer will be spironolactone. So what is spironolactone? Spironolactone is a aldosterone antagonist. It is aldosterone antagonist. It is antagonizing what? The action of aldosterone. So spironolactone is actually antagonizing the action of aldosterone. And the last is your ENaC blocker. You know ENaC? Aldosterone work on ENaC for absorption of sodium. ENaC is epithelial sodium channel. So there is a certain kinds of diuretic which block ENaC. Okay, ENaC blocker. And the example is amyloride. So now I will recap all the diuretics. So number one diuretic, if you open the book Guyton, there's a chapter of diuretic and there's a table given. So I'm summarizing. Number one diuretic is your carbonic anhydrase inhibitor acetazolamide. It is a mild diuretic. Why? Because it is working on the PCT. Okay, only it is inhibiting the absorption of bicarbonate. So more often it is given for acclimatization, for glaucoma, for some brain injury. I mean brain edema. In that case, it can help, but not as a major diuretic. So first working on PCT is your carbonic anhydrase inhibitor. Second, working on TAL, thick ascending loop of inlay. Which channel? NKCC. What is NKCC? Sodium potassium 2 chloride channel. So which diuretic is going to block sodium potassium 2 chloride channel? What is your answer now? Loop diuretic. Furosemide. You will get extended mark if you answer this. Loop diuretic. They are well known fact which every doctor should know from MBBS first year onward. So the first was acetazolamide. It was carbonic anhydrase inhibitor. Second is your loop diuretic. It is working on NKCC, sodium, potassium, 2 chloride channel. And the side effect is what? Hypokalemia. It also releases calcium from the urine. I told you more clearance of calcium from the urine, increased clearance of calcium from the urine. So calcium start coming from the urine. And the third diuretic which acts on DCT, distal convoluted tubule, is your NCC, sodium chloride channel. Okay, and what is the name? Thiazide diuretic. Thiazide diuretic. And the wonderful part is that when we are giving thiazide diuretic, it is increasing calcium absorption. It is increasing absorption of calcium. So how it is going to help you? It can also be given in case of recurrent kidney stone, because when calcium will pass from the tract, it will be forming the kidney stone. So those patients who are having a recurrent, nephrolithiasis, you can give thiazides. Fourth is your aldosterone antagonist, spironolactone, the potassium sparing diuretic. And the last I have told you, ENaC blocker, epithelial sodium channel blocker called as amyloride. After this section, if you open the book Guyton or Ganon, please see that table, and that will be forever with you. It is going to help you in your MBBS and as a doctor also. Okay, so this is it for today's short session. I cannot extend more than that. So every Monday and Friday, I'll be taking an ultra short session for only 10 minutes just to recap certain points from the main video. Okay, so this is it for today. All the very best. Bye bye. Take care. Good night.